Hello friends, colleagues, students. Welcome on MuniMeterHealth, your source of learning cardiology and human heart illness. This is Dr. Jaitly from New York, your cardiologist. Today we're going to be talking about briefly what is a mitral clip and is it being used for heart failure, and is that a near possibility that our patients can avail of? Well, this is published in the New England Journal of Medicine only recently. And I do want to say and congratulate the articles and the authors, because they've done a fantastic job in coming out with profound results. What is a mitral clip? A mitral clip, let's understand what is the function of the heart in a setting where you have heart failure. First, these are your mitral valves, as I'm drawing in a sketch. This is your left atrium, and this being your left ventricle. So as a result, what's happening is there is a regurgitation happening because of the mitral valve not closing fully when the left ventricle contracts. Remember, the left ventricle contracts, empties out into the aorta, correct? That's the flow of the heart. In a setting where somebody has heart failure, what happens is there's a mitral regurgitation happening, so the blood is now flowing back into the left atrium and not into the left ventricle. Now, that's not a very cost-effective pump, right? Because it's a dysfunctional pump. The left ventricle is now regurgitating back into the left atrium as a result. So this mitral valve is considered as incompetent, and therefore we call it mitral regurgitation. Okay, now it could be degenerative, it could be rheumatic, it could be because of other congenital abnormalities, but remember, mitral clip is an obviously we are going to talk about that device in a second, but that device is indicated only so far for a degenerative cause of mitral regurgitation. Rheumatic is a no-no right now, and calcification is a no-no right now, because the trials have not shown any benefits there. Plus, it may be high risk. So now the question is, how do you approach? Now, it's a venous access, just like you normally do a cardiac cath. So the catheter is now advanced. We'll show it with a different color here, so this way it looks a little more clear in the schematic. So the catheter is dropped into the left atrium. And when it comes into the left atrium, by the way, it is carrying the leaflets or the mitral clip in this fashion. Now I'm showing you the leaflet, and as the catheter is positioned right above the mitral regurgitation that's happening here, now this is all guided by the trans-esophageal echo. It's all happening in the cath lab. Remember, all of this is happening, the procedure is happening in the cath lab. And of course, the patient is sedated, may be intubated, etc., etc. Okay, so under the trans-esophageal echocardiography guidance, which is real-time imaging, you can advance this catheter way down into the left ventricle. You drop it into the left ventricle while the mitral valve is closing and opening. Obviously, it's a regurgitant valve. It's not a functional valve. So there is a whole bunch of mitral regurgitation that one encounters as you're approaching via T-guided advancement. So the catheter is dropped here, and now you have your leaflet sitting, mitral clip sitting here. Instead of being here, now you dropped it into the left ventricle. Now what you do is you move this, the technique is the operator or whoever the invasive cardiologist is, interventional cardiologist, will advance this up so that the leaflets can now be repositioned and placed in. So let's go to another schematic here. This is what the result is, the final result is. So you have the mitral valve leaflets here, right there. And now what happened is, we'll show the same color possibly. And then you have this leaflet and this leaflet here. These are your mitral clips. So these mitral clips will be left and the catheter is yanked out. So what's happening is now you have narrowed the opening of the mitral valve leaflet functionally or effectively. As a result, you have a minimal mitral regurg. So you have a very minimal mitral regurg or none at all. And this could be done within a couple of trials, because as you go down, you try a position and say, you still have a little bit of mitral regurg left. All right, you go back in and again. So these clips will hold the edges of the mitral valve leaflet in such a fashion that it's so tight, now you don't have any regurgitation or minimal regurgitation. Immediately the heart says thank you, because now you don't have a mitral regurg. So the remodeling microscopically or macroscopically literally begins in the next heartbeat. So the principle is awesome, and obviously it requires more safety measures improvement. And again, FDA has not approved it as of yet, but in Europe there are trials which were not as effective, I should say. But the fact is that the one done in the in US and Canada. That has been published in the New England Journal of Medicine only recently this week, and that has shown huge promising results both for survival patterns as well as for reduced hospitalization rates for the heart failure patients. Okay, so quickly let's understand what the procedure is. Well, procedure I just explained, it's basically a non-invasive procedure meant for patients who do not qualify for open heart surgery. So remember, it has to be done for patients who do not qualify for open heart. So they are high-risk patients, obviously, and these patients are either elderly or they have other comorbidities, which prohibit the open heart procedures. So you can go ahead and do a mitral clip in that sense. Secondly, these patients are obviously sedated, as I said, and they may be intubated for a few hours post-procedure. It's all done in the cath lab, and then you require a TE, as I said, during the time when the procedure is done. Normally takes about 1 to 3 hours. Let's take 3 hours as a standard. Now, it's a venous access, and it's done, as I said, the procedure is done exactly like I've shown you here, and then the final result is where the leaflets, or the mitral clip leaflets, they are attached to the edges of the native leaflets, as is. So the mitral regurgitation, very, very minimal or none. Safety. Well, the safety is huge. The only thing that you have to worry about is infective endocarditis, like any other, mitral foreign device. Embolization can occur. It's called device embolization because device can mobilize, unfortunately, because remember, it's going along with the leaflet contractility each time, so or movement each time. So the device embolization is a possibility. Bleeding from the site is one of the problems and may require transfusions, but it's definitely less than the open heart transfusions that somebody requires. Precautions, obviously you have to worry about certain things like obviously there's no existing infection as is, so the infection should be ruled out. There is no other contraindication like a procedure like a bleeding diathesis, and these are some of the precautions. And again, make sure that the patient does have a 4+ MR mitral regurgitation, and of course has a heart failure where the LVEF is less than 35%. So these are the criteria again to have these patients go for this procedure. So we've done the procedure, the safety, the precautions, and the outcomes. The most important thing is obviously the outcomes. You want to know if the outcomes were great. Well, the hospitalization rates are reduced. These patients can be discharged in a matter of 1 to 3 days, and the recurrent hospitalizations that's prevalent for heart failure notoriously, that is also reduced. And then you are left with the prolongation of survival. So survival for the first time has been shown to increase in these patients. They have lived longer, specifically the ones who received the mitral clips. So what they did was, this was a randomized trial where they actually did standard care. They offered standard care of heart failure, and standard care plus the mitral clip. And when they offered the mitral clip, these patients lived longer as opposed to these patients who did not live longer. So this was a prolongation of survival in standard care plus mitral clips as opposed to plain old standard care. So first time randomized trial which has shown that the mitral clip is working for patients with heart failure. Seems very promising. Is that a near possibility? I think so, and we are awaiting the FDA approval, but I'm very, very pleased to see this article in the New England Journal of Medicine, and we congratulate the authors. Thanks again for this quick attention onto my video. I appreciate your attention, your kindness, and of course do write comments, suggestions, and questions if you have any. And of course, if you like this video, please press the like button. Looking forward to meeting you again on my next video lecture. Bye now.